Hi, everyone. My name is Nico Murillo, and thank you so much for joining us this Memorial Day weekend. Today, I want to remember the fallen soldiers who gave their lives for us so we could enjoy the freedoms we have today. And even with today's circumstances, let's take some time to appreciate and show gratitude to those selfless individuals and listen to a quote from former President John F. Kennedy. As we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. So change requires action, and we all owe it to our country to fight for safe access here on home soil. So let's remember these fallen soldiers today and thank a veteran that you know for their service for our country. Texans for Safe Access is part of a national organization called Americans for Safe Access, and we advocate for the acceptance of medical marijuana for therapeutic uses. Some of our beliefs are that medical professionals can recommend medical cannabis, that patients and their caregivers have the information they need to make educated choices about medical cannabis therapies, and that patients and medical professionals can incorporate a diverse group of products and delivery methods to create the required personalized treatment regimen. So really what this means is that patients need access to various forms of medical cannabis to meet their medical needs. Various products offer different benefits, and they work synergistically with the body and the endocannabinoid system to provide relief. So we're going to cover a lot of these topics and more with two ladies that I'm really excited to introduce you to, Dr. Olga and Dr. Dorita Doce. So I want to bring on the ladies, and I will read their bios for us. Hi, ladies. How are y'all doing?
Hello.
Awesome.
Doing great.
Awesome. Okay. Dr. Olga here is a native Houstonian, board-certified emergency physician, board-certified eligible lifestyle medicine coach, practicing cannabinologist, and Texas State registered compassionate use doctor. She works with patients across the United States to refine their health with cutting-edge lifestyle changes and a tincture of cannabis in legal states. Dr. Olga believes cannabis is an important and promising medical plant and enjoys educating anyone who will listen. Dr. Olga is on TSA's board as our physician educator and leads us in medical outreach and education. So welcome, Dr. Olga. We also have Dr. Dorita Doce, and she is a cannabinologist of clinical pharmacist specializing in pain and psychiatric medicine. She is a retired major from the U.S. Army with nearly 9 years of service. She has a wealth of knowledge in the field of clinical pharmacy, pain and psychiatric medicine, focusing on the Army Warrior Transition Unit soldiers. So thank you both ladies for being here with us. And I'm really excited to bring this topic to our community. So I want to jump right into it with y'all. So Dr. Olga, can you tell me why patients would need multiple products, oral, topical, and smokable? Why do we need all of them?
Well, what you're describing is a diverse medical portfolio or medical cannabis portfolio, and diversity equals custom medicine. So no one person is the same, no mother is the same as their child, or vice versa, etc. So everyone is going to need to be able to have an arsenal to refer to. One of the main reasons is that a route is a way that you take it. So one example of a route is oral or edible. Each route has a different time frame that it starts to work. Some come on as quick as 2 to 5 minutes, and then some of them take about an hour or two to come on. Likewise, each one lasts for a different amount of time. So some of them last for less than an hour, whereas other ones can last for 48 hours or more, depending on your blood levels. So you want to make sure that you have all of these options readily available to you, not only as a patient because you're different, but also because it's basically your right. So for example, I have a patient who I'm using for this example, and I want to make sure everybody understands this is specifically for this patient. She has severe anxiety And so when she has her baseline anxiety and then an attack, I will tell her to take 2 puffs of her vaporizer because it acts very quickly. Then I will tell her to take 2 drops of her thin oil underneath her tongue. And then I will tell her to take an equivalent of 2 doses of her rice grain thick oil between 2 slices of banana. So she's taking 3 different routes at once because of the severity of her disease, the severity of her attack, and her individual body. And so if she did not have those 3 routes, it would be very difficult to control a severe anxiety attack for her.
Awesome. Well, thank you for that. Okay, so Dr. Dorina, can you tell me, is there a difference in cannabinoids that are targeted for like muscle pain or nerve pain?
So you have to, I like to always explain to people where are those receptors, your cannabinoid 1 and your 2 receptors. And also you have to understand the type of pains that you have. Cannabinoid receptors, for example, are present in that pain pathway, starting from your periphery, your outside, your fingers, your toes, all the way up to your spinal cord. So the CB1 receptors that usually are where THC works on tend to be located heavily in the brain area and also the spinal cord and a little bit in your periphery. So patients that have problems with neuropathic pain, because there are different kind of pains. You have the somatic pain that is like the joint injury or your muscle pain, or you have the neuropathic pain, it's the second type, or the third one is your visceral pain, which is your internal organ injuries. So when you're dealing with neuropathic pain, it's very important to target that CB1 receptor while you're also targeting your external organs. So because the central nervous system controls that pain, you also want to regulate that inflammation that is caused. So there are also CB1 receptors that are inside the neurons as well. So that mechanism, when you take THC, helps regulate the pain from the brain. So those kind of pains are like your help me out. What are neuropathic pains? Fibromyalgia, for example, for rheumatoid arthritis. Those are pains that are related to your immune system, which CB1 receptors also work on. Now, if you have an injured knee, for example, it would make sense to use a topical application and maybe not necessarily something with higher THC. So topical, localized, generalized pain, I would focus on the hemp application, which has less than 0.3%, and that works great. Now, what people also don't understand, just because you have a localized pain doesn't mean you won't benefit from a full systemic application. So instead of just doing the localized application, go ahead and do the topical, the oil under your tongue or in your cheek area. And then that way you're not just targeting one localized pain, because also you could be regulating that homeostasis for that natural balance in your body that can help you and help your immune system for other issues that your body might be suffering from and you don't know. So yeah, there are different kind of pains, and depending on what kind of pain, you can regulate it with either more THC or less THC.
Perfect. Okay, so I think that kind of answers my next question. But so Dr. Olga, I have a question. If from a veteran, so he has an injury from his time in the service, can topicals help with the pain, and what other forms can help him with nerve and muscle pain?
That's a very good question. So in order to answer that question, and Dr. Doce went into some detail, we want to make sure that we understand that there are different types of topicals. So just for to answer that question, I'm going to divide it into 2 categories. There's dermal, which is, if you hear dermal, think local or right where it hurts, and transdermal, which is, if you hear it, think where it hurts and beyond. And so if you're suffering from a muscle or a nerve or an injury that you want to treat with a topical, you want to first decide if you want something that will just relieve at that site, or if you're having pain at that site and say like it's at your wrist and it goes to your elbow, you may want to use something that's more transdermal. And so in this case, I would say the veteran should, and I should talk about how far they want their pain relief to go. The topicals can help in that situation.
Perfect. And will people get high from topical creams, Dr. Olga?
Again, the answer is in what type of topical are you using? Is it one that is just going to stay local, which is called dermal? Those kinds of topicals generally will just be absorbed into the skin and the local fat. They will not cross into the blood. Or are you using something that's more far-reaching or transdermal? Transdermal topicals will generally come with an additive that will allow it to permeate through your skin into the blood and reach a bit further. Those transdermal applications have been shown to increase, for example, THC levels in the blood, and can even cross the blood-brain barrier, which is how you become quote unquote high, which several shows ago we said that we didn't like that word, but it causes you to feel that wonderful euphoric effect, or for some people, if you don't want it, that effect, if it's transdermal. And so you want to make sure that you're differentiating which type you're using first, and then that'll answer that question better.
And so I'm thinking of a difference between like a balm and an actual transdermal patch. Would that be correct of the type of patch?
But we got to be careful because some balms now do come with those additives.
I see.
Yeah, they tend to topical.
So like they're nanoparticulated, or so they can enter the bloodstream, correct? Something of that nature. Okay, cool. Thank you for that. Dr. Dorina, can you tell us a little bit about the various forms of medical cannabis and give us some examples of each?
So I have pretty much seen all the same stuff that you see in the pharmaceutical industry. They're getting very creative, which is a good thing because different dosage forms means ease or more accessible and convenience for the patients, right? So they come in the oral route, which that consists of the buccal route, which goes between your cheeks and your teeth, or sublingually, which goes under your tongue. There's also the capsule or tablet. Now, there are also the ones where you mix in water. I would be careful. I'm going to talk more about the forms that are being mixed with food. And also there's the topicals, which ranges anywhere from oil to salve, balms, ointment, gel, patches. Then there's the inhaled ones. There's the vaporized, smoking, inhalers. There's the nasal sprays. There's suppositories. There's vaginal oil. So pretty much any route that your body can actually transfer the drug internally, well, I have seen it out there. Now, I will warn people of what's out there now because you see it, they're putting CBD in almost everything. Be careful of that, the shampoo and the lotion and the food and the drink and the water, because when you're dealing with medicinally, you want to know what's your effective dose. And when you start to add these from every different source, you don't know what's working. So it's good to start with one, stick to that, and probably stick to the brand too, because different farms where they come from will give you a different result.
So thank you, Dr. Dorina. Can you also tell us what I should expect from a smokable form of medical cannabis?
Sure. So the smokable form is what I call fast in, fast out. It's a really common method. One advantage it has over, for example, if you are to take it orally that goes through your stomach, is that you're avoiding the path to go through your liver. So, and that's also an advantage and a disadvantage, because when you're inhaling it, you're missing out on certain chemicals that gives you that longer term effect in your body. So when you inhale it, it doesn't stay in your system as much as when you actually take it orally. It tends to kick in about 3 to 10 minutes. People feel it immediately, right away. They tell you, I feel it right away, but that's usually 3 to 10 minutes. And then it peaks. You get the highest dose at about 15 to 30 minutes. And it lasts in your body for a good 3 to 6 hours. Now, depending also, this also changes The how long it stays in your body varies based on how you smoke it and how often you smoke it. Some people inhale it faster, therefore inhale in fast and then in and out. It doesn't penetrate and goes into mixes with your blood vessels, as well as if you are to take it in and you hold it. So the method also varies how long it could stay in your body. Some people say, well, it stays in my body up to 27 hours. Also, are you a chronic user versus an acute user? Are you using it once? Then maybe you'll see, after a few hours, you're not going to feel that sedative effect or, the therapeutic effect so much. But if you're a chronic user, you will feel it for a longer period of time. So it's important to know how often you do it too.
Okay, perfect. Dr. Olga, can you tell me what type of considerations I should take whenever I'm using cannabis for anxiety?
Oh, that's also a good question. So when a patient comes to me asking me about treatment for anxiety, which is a very common reason for the use of hemp in the state of Texas, what we have to address is, what is the source of your anxiety? That will tell us or tell me what strains or types of medical hemp or medical marijuana you should use. If your anxiety is work-related, for example, then I would suggest that you spot dose. And that spot dose would be a lower THC content form of medical hemp or marijuana. If you have PTSD, I generally would recommend a middle range percentage of THC, or I might even recommend no THC at all. If you are someone that suffers with bipolar disorder or paranoid type of anxiety, which PTSD tends to be, then I might recommend an extremely low dose or low percentage of THC. And then there are some forms of medical hemp or marijuana that I recommend almost no THC at all. And that's generally for very young individuals, very old individuals, or individuals that have to operate heavy machinery while they're controlling their anxiety. So this is all dependent on the type of anxiety that we're treating, the source of your anxiety, your age, and your functionability, what you need to be able to be doing while you're controlling your anxiety.
Okay, perfect. And Dr. Olga, can you tell me, what about products for sleep? Would they be similar, or are they different than the ones I would use for anxiety?
One of my favorite topics. I love treating disorders. I think with medical marijuana and medical hemp, I think it's so helpful. But again, it does depend on how long you need to sleep, what is the cause of your, I'll call it insomnia. It's not always insomnia, but what is the cause of your insomnia? And that will tell me, help me guide you into what we should try. Generally, they are medical compositions that have a lot of something called CBN and CBD, of course, and then a little bit of THC. Generally, THC is not usually necessary in my patient population to help with sleep. And then, of course, there's other things that we have to consider, which is terpenes. The entourage effect is very necessary for your endocannabinoid system in order to kind of regulate your circadian rhythm, which is a big word for the rhythm that controls your sleep. So yes, there are products that can help, and they're generally higher in the CB cannabinoids.
Awesome. We all need our sleeps, key to health. And so, Dr. Dorina, if I've never used cannabis, where should I start?
So first of all, we need to know what you're trying to use it for, so we can tailor that around what, the dosage and the percentage, like Dr. Olga was mentioning, THC, CBN, CBG. What are you trying to treat? Is it sleep or is it pain? It varies. Sorry. I always like to tell people, start low and start slow. Meaning, and I prefer the full flower just because we tend to talk a lot about the CBD and THC, THC and CBN. but there are over 500 different chemicals in that plant and stuff that we don't even know how they work yet, but we do know about that entourage effect that Dr. Olga was talking about. So there are terpenes and other chemicals that can definitely help us with other issues that we don't know about. Now, if you want to do the cannabis, which is a form of marijuana, of course, do the marijuana with like 2 to 3%, maybe, or just start with hemp that is 0.3%. So the lowest concentration of THC you can find around you. If you're not into vaporizing it or inhaling it, I would definitely do the tea. Make sure you simmer it in full fat milk content. That way, because you need that fatty substance to pull out the THC and all the different cannabinoids from the plant. So start with the tea if you're not into the smoking, which I respect. Or if you want to do the full extracted, full spectrum oil, that's also very good.
That's awesome. Yeah, well, Texans for Safe Access definitely believes in whole plant medicine and the entourage effect. So, let's see, Dr. Olga, can you tell me how I decide what the best route is for me to take medical cannabis?
Dr. Doce really just touched on this as well. And we talked about it a little bit in the beginning. Start low, grow slow, and then I will add and be prepared to be patient. So I like to start with a route that will start to act fairly quickly and last a little bit shorter. And so those for me in my patient population are the vaporized forms, the smoked forms, or the sublingual forms or the topical forms. The reason why I start with those is because then we can see, it helps to give us an idea of if you'll even have an appropriate response without you having to be with that response too long if you don't like what you're feeling. And so, for example, if a patient comes to me brand new, they tell me the condition they want to address, I say, let's try this in a specific ratio. I will be with them while they try that form in the vaporized form, or we'll be on a telehealth conference, and they'll tell me how they're feeling. They'll tell me if their pain is gone, for example, or if their anxiety is gone. And if it works, then we'll talk about changing that to the oral route, which is the route that I much prefer for long-term use. And so that's generally how we work together to figure out what routes and what forms are best for you. If you're doing it on your own, which I don't want to take away a patient's power, you can do it on your own. I strongly recommend you do it with a medical marijuana physician or medical marijuana pharmacist. Strongly recommend that. But if you do it on your own, that's generally the same way you would do it. Small doses possible, go slow. Slow is over hours, and be patient. And then start with a route that is quick on and quick off.
I like it. Low and slow, just like smoking Texas barbecue. Low temperature, long times. So, Dr. Darina, can you tell us how we can find quality products?
So the hemp industry is not a well-regulated industry. It's not a pharmaceutical. It's not vitamins. It's not herbs. So it's kind of like in a limbo on its own. And it's, to be honest with you, it's a little scary, because when I started looking into the field initially for my own personal use, this is what got me interested, was the lack of regulations and the craziness involved in how the products are made and then also tested. So you have to think about the cannabis plant is a very adaptable plant. So wherever you put it, it will grow, meaning it will absorb whatever is in that soil and it will thrive. That whatever is absorbed in that plant, eventually, if they squeeze that plant or you smoke it, you're smoking everything that was in that land. So it's very important to know, where is it coming from? That's one. Second, we see a lot about, it's third-party testing. Got that. That's a great, commercial advertisement technique. But also, because the lab is not really regulated either, right? So when I started going to these conventions, a few of the PhD professors that are in the lab industry, they're like, you have to be careful, because You could be, Nico, you could buy that the lab spectrometer or the machine from China or from somewhere that is probably not in date for use anymore, and then register that as a business. And then Olga, you make a new brand and you send it to Nico, and Nico tests it, right? So Nico is testing it without specific standards. What are you testing it against? When you do blood tests for diabetes, for sugar, there are ranges. Those machines have to be tested. They have to go through quality testing. And if they don't pass those testing, the government will shut you down. Now, with the cannabis labs, there's none of that in place. We don't know exactly what we're testing for. You get different certificate of analysis from different products, or you send that same sample to 10 different labs. 10 different labs will give you 10 different results. And that's because there's no regulations in place. And also, is there even CBD in these products? You see them everywhere, and then people are like, well, I've taken them, they don't work. Well, because there's no regulation, and CBD is an expensive chemical, you don't know what's in it. So now you see it everywhere in the gas stations, in the hair salons, and everything's like, is that even good? Is it even legit product? So read a lot of reviews, ask, if you have a physician on hand or a doctor or a nurse, ask them for their personal experience, because they have patients that have used it and they will tell you brand A is better than brand B. This one I had this interaction with, and stay consistent with the brand. So do your due diligence with research, because everybody out there is making them now. And here's a funny story. When I went to one of the conventions, one of the things I'm interested in is actually starting my own, CGMP lab. That's current good manufacturing procedure lab that is certified by the FDA. So I'm going through the process of doing that. And then one of the labs, they had this beautiful setup, one of the brands. And I was like, so what does your lab looks like? I'm thinking, just to kind of give me an idea of the size I need and the equipment. And to my surprise, the lady was like, well, the owner of the brand has a restaurant, and after the restaurant is closed, we use her kitchen to make these. And I don't remember my response after that. I was blown away. And here they are making it. And of course, if you read some of those certificate of analysis, you will see examples of they were contaminated with human blood, with dog hairs, with perfumes, with nail polish. And so it's very important to find a reputable brand that has good reputations.
Yeah, I agree too. Third-party testing at certified labs, and unfortunately, the DEA just released, or the federal government released, the DEA required certification for analytical laboratories to be able to test CBD products. So, there are a lot of pop-up laboratories, unfortunately, but I agree with you 100%, understanding the certificate of analysis, knowing where the source is, and working to understand who's making it and how they're making it is so important in finding a quality product. So, okay. Well, thank you for that. Dr. Olga, can you talk to us a little bit about if my child wants to take medical cannabis, if there's one route that's safer than another for us?
I would never recommend a child vaporize or smoke, ever. The reason why is the amount, the rapid onset, and then the way that it has to be introduced. We're already kind of taking a chance, I'll say, with giving these plant-based medications in the first place. I would recommend limiting the different areas, the different routes that we gave to a child. I will say that children do take medical marijuana, and they do well with it. And children of most ages that I've seen after age 1 month. The youngest child that I've seen take medical marijuana was a research paper. She started at 8 months because she had an inoperable brain tumor, and she survived. So I will say that children can take it. It is something that you definitely want to consult with either a medical marijuana pharmacist, a medical marijuana clinician, preferably one that works with with children, excuse me. And the routes that I would recommend are definitely oral or suppository. And topical, I think, would be also another consideration, both dermal and transdermal. And then aerosolized, if it's available and it's well researched and it's well tested and it is something that you've spoken with your medical specialist about, is something that I have heard coming down the pipeline that might be a viable option for a lung delivery. And as far as the forms, every child is different. And we have found that children actually oftentimes require quite a bit of THC for their various conditions. And it has to do with their metabolism being so different than their adult form. And so the full spectrum of plant-based, whole plant, medical marijuana all the way to hemp is something that should be open to children.
Awesome. Well, thank you for that, Dr. Olga. All right. So, Dr. Darina, is there a route that is more likely to make me addicted or dependent to medical cannabis?
So that's a good question, because dependency, as we know, is linked more to your genes. Now, also, that's also a fair assessment, because some people will say, well, I'm not genetically inclined to have addiction to opiates, but they put me on opiates and I became addicted. So yeah, we have to understand the mechanism of how each substance works. Opiate, for example, is associated with an increased formation of receptors of your of your opiate receptors. So we give you one dose, you take it for a while, but then after that you need more because your brain is forming new receptors. With cannabis, we don't see that. Also, your genes play a major role in how you develop or how you respond to drugs. You can have more than one child. One will be completely healthy. Another one will is born with different problems, medical problems. And it's because they have a faulty gene. So what that means here in this situation, the cannabinoid receptors 1, those that are encoded by a gene called CNR1, they have also noticed that those CNR1s actually sometimes are faulty or have variations. And those variations have been found in patients that have cannabis and substance use disorders. So it's not necessarily that they're going to be addicted to cannabis. They could have addictions to other substances. Now, most experts will also agree that dependency on a substance is accompanied by a buildup of tolerance, like we're mentioning, to a substance, requiring you to have that larger dose. Well, most marijuana users don't experience either the withdrawal or tolerance effect when they stop using marijuana. There was also, I read a very interesting article from Dr. Alex Stalcup. He is the medical director for the New Leaf Treatment Center in California. And he was saying that 60% of the patients that he treats for medical marijuana addiction actually also have other predisposing mental health conditions such as anxiety, depression, PTSD, schizophrenia. So we don't know really if this is a true dependency or if these patients actually have experienced relief on the cannabis and they just simply don't want to get off of it because they're afraid of relapsing and going back to those situations. So this is how you know if you're addicted or not. When you stop taking cannabis, are you going to have negative reactions? Most likely you're not going to. It's a very safe plant. What some patients who, and this is we're talking now about high users, and those high users are people that smoke like 25 days out of the month and smoke several times a day. Those patients, when they stop smoking, they notice a little bit of mood changes, irritability, and variations in their sleep pattern. That tends to go away after a few days. That's a common reaction.
Perfect. All right. Well, thank you for that, Dr. Darina. And so this is our last question, and it is: if I get drug tested, what products should I make sure that I am not using so I don't test positive? And that goes to Dr. Darina.
So there's the chemicals that are usually targeted are usually the THC. Now you also have to be careful because CBN is the aged form of THC. So I would stay away from the flowers full spectrum and broad spectrum, because those might have CBN or THC or traces of those. And cannabinoids happen to be lipophilic, meaning they get stored in your fatty tissue. So you might not have taken it for a couple of days, but what you took a week ago is actually built up in your system. So basically full spectrum, broad spectrum, or any flower that will, because the flower is full spectrum. And if you don't want to test positive, get something that does not contain THC or CBN. Very careful of those.
Perfect. Well, thank you for that. Okay, ladies, well, that's all I have. So I want to thank you both for joining us. And is there anything else y'all would like to add before we sign off?
I want to stop the stigma. I want to stop the stigma with this taboo, because we need to normalize cannabis. It's another healthy option. Everybody needs to know about it. We need to spread the good word. And I want to change the stigma that you're getting high. You want to just, have fun. There's nothing wrong with having fun, for heaven's sakes. Why can't we be happy? If that's we have a lot of miserable people walking around. Let's be happy, but also let's be healthy.
Thank you. Thank you for that. Dr. Olga, anything else from you?
Ditto.
Well, I want to thank y'all both so much for joining us and this awesome conversation, and for all y'all do for our chapter. So thank y'all both for being here.
Pleasure. Thank you.
All right. So I just want to finish up here and thank you all again for joining us. Patients need access to various forms of medical cannabis to meet their needs, and this needs to be left up between them and their physicians. Being your own medical advocate is being able to determine the best use of therapies with your physician, and who else other than your doctor knows such intimate and personal details of your life and health. So if you need help talking to your physician, please go to our website onto our resource tab, and you can see a tab there that will talk to you about how you can talk to your doctor. You will also find other resources there for the patients that are there free for you to use. So also sign up to our monthly newsletter and follow us on our daily activities online on Facebook. I want to thank you again for joining us, and tune in on June the 6th here on Facebook for our monthly member meeting. Thanks so much. Have a great Memorial weekend and take care.